Hello, folks. Today we're going to talk about a topic that's often misunderstood: why people refuse treatment for mental health or substance use problems, also called concurrent disorders. This is a complex issue and it affects far more Canadians than you might think. I'm Ron, your host and editor of Learning Moments, and welcome. Learning Moments is created to help everyone understand substances and mental health disorders. Before we talk about concurrent disorders, it helps to look at treatment refusal in a broader context. Some of the most striking examples I've ever seen involve tobacco addiction. Even faced with diagnosis of throat or lung cancer, some folks were still unable to stop smoking, and they continued right up until their deaths. Concurrent disorders often occur when someone experiences both a mental health condition like depression or anxiety and a substance use disorder like alcohol or an opiate dependency. In Canada, nearly 1 in 5 adults will experience a mental health disorder in their lifetime, often with a substance disorder too. And the reality is, one condition often makes the other worse. Someone with depression, for example, might use drugs or alcohol to cope, which deepens the depression and increases dependency. Self-medication is a huge factor because in the short term, most people gain some level of relief from their mental health symptoms. Of course, substances almost always worsen mental health situations in the long term. Unfortunately, by then, addiction is set in and it feels impossible for folks to stop. So what does it mean when we say someone is refusing treatment? It's not always a clear no. It can look like delaying care, or stopping treatment early, or never following through with the plan that their care workers and themselves have created. It's very different from wanting help but being unable to access it due to costs or wait times or distance. True refusal often comes from not believing help is needed, preferring to manage their condition alone, or they fear judgment. Trust is a big factor. Folks with anxiety disorders often take the longest to seek help. In Canada, it's about an average of 11 years. Those with substance disorders usually take around 8 years. And those with mood disorders, on the average, are about 3 years. Nearly half of the people diagnosed with anxiety or depression may never seek help at all. And while women are more likely to seek help for mental health issues, they are less likely to reach out for substance use support. And young adults and people with financial or housing challenges, they often fall through the cracks completely. But here's something important. Refusing treatment is not always the individual's choice. Addiction itself can make it nearly impossible to start treatment. Addiction is a chronic health condition that changes the brain and it alters decision-making and reward systems in the brain. Someone may know their substance use is harmful, yet still feel unable to stop or fully engage in a program. Similarly, a neurological condition called anosognosia, I think I said that right, can make people unaware that they are ill. It's not stubbornness or denial. It's a biological symptom of other things that are going on in their brain. Basically, they don't see themselves as sick. Someone with schizophrenia, bipolar disorder, or severe depression may genuinely believe they don't need help. Combine this with substance use and treatment refusal becomes even more understandable. And you can see from the perspective of caregivers, frustrating and at times impossible to understand why people refuse. But if you don't think you're sick, why would you go for any kind of treatment? And then we run into stigma, shame, and fear. Many sufferers worry about judgment from families, employers, or healthcare providers, and mistrust runs deep in some communities, including Indigenous folks, 2S LGBTQI plus folks, poverty, and marginalized individuals, often due to past discrimination or poor communication. Even the healthcare system can contribute to a refusal. Mental health and addiction services are often fragmented. Some programs require complete abstinence as a condition of entry, or may just discharge someone immediately after they experience or have a relapse. Short-term detox can even increase overdose risks if a person returns to a previous dose without support. And once treatment ends, people may be discharged into environments that make staying substance-free nearly impossible. So what can folks say? What can help folks say yes to treatment? First, integrated care models, programs that treat mental health and substance use together. They're far, far more effective. Second, fighting stigma and sharing accurate information helps people understand that addiction is a health issue, not a moral failing. Third, culturally safe and accessible services are critical. This includes training providers, offering programs in multiple languages, and reducing out-of-pocket expenses for patients. Fourth, empowering patients, involving them in their care decisions, and providing early support, especially for young adults. It makes a huge difference. In the end, refusing treatment is rarely about willpower. It is shaped by stigma, fear, past harm, and systematic gaps. Those who are most effective often include Indigenous folks, youth, radicalized communities, and people with fewer resources. But there is hope. By centering compassion, equity, and accessibility, we can create a system where everyone feels welcome to seek help. A system that meets people where they are, respects their experiences, and offers flexible, integrated care. Thanks for watching Learning Moments. If you or someone you know is struggling with mental health or substance use issues, reach out to healthcare professionals or check out local resources in your community. Until next time, remember that understanding is the first step towards change. This video is a companion piece to a written article titled When They Refuse Treatment. You can find this and more articles, videos, and resources on Learning Moments at Learning Moments, that's all one word, .substack.com. If today's Learning Moments resonated with you, please share it with someone who might need to hear it. And thank you for joining me today. And remember, change begins when we start talking. Until next time, stay informed, stay connected, and be kind. Thanks. Bye for now.